My name is Christopher Foran. I'm a fourth-year medical student from Thomas Jefferson University in Philadelphia. I'm here for a 4-week rotation in the emergency department of Clínica Soma under the supervision of Dr. Cohen. My internship consisted of 4 weeks working here in the Department de Urgencias, or the emergency department. I would come in at 8 a.m. every day, and I would join with the interns from La Universidad 6, who are in their final year of medical school training before residency. And between 8 o'clock and 4 p.m. we would see patients together, do patient interviews, present the patients to the attending physicians here, review the plan, and then follow up the patient's treatment plan. I think the two big challenges were, the most obvious being the language barrier. I came down able to speak quite a bit of Spanish, but it's a very different environment when everyone speaks Spanish, not just the patient. So learning how to not only get a medical history from a patient, but also presenting that history to an attending, discussing difficult cases, learning the vocabulary of medical Spanish was certainly a challenge, and also trying to communicate with patients when they're in pain, when they have some sort of deficit, or when they're confused or scared. It can be a very difficult thing as well. The other challenge was learning the system here in Colombia versus the system I'm used to in the United States. While we all read the same literature, the hospital has a little bit different way of running their emergency department than ours does in the United States. So it took a little getting used to, but my attendings and my fellow interns and residents were very helpful. I think the highlight of my internship was the first patient that I was able to interview and present on my own. Dr. Mario allowed me to see a patient unaided, speak to them, get their history, find out what was going on, come up with a plan, and then see that plan implemented. And even though it was an acute appendicitis, which is typically it's a very common and simple diagnosis, it was still very exciting for me to be able to do that completely in Spanish on my own for the first time. So that was probably the highlight of the internship. My advice to any future interns would be to make sure that you know what your level of Spanish is before you arrive, and if you don't have a high level of Spanish and you don't practice much in the States, I would recommend taking classes while you're down here to improve your Spanish. When I get back to the United States, I have 2 rotations left, a orthopedic surgery rotation and a radiology rotation at my home school of Jefferson Medical College. Afterwards, I have a month of vacation. I'll be going to Africa to climb Kilimanjaro, and after that I graduate at the end of May and begin my military service out in San Diego with the Navy. I'll be doing a transitional year and then going out to the fleet for a couple of years to treat sailors or Marines.